reform. As controversial as the efforts to reform health care have been thus far, when you ask people, should we move forward and try to reform the system, people still say yes. They still want to see change. And it strikes me that if we've got an open mind, if we're listening to each other, if we're not engaging in sort of the tit for tat and trying to score political points during the next several hours, that we might be able to make some progress. And if not, at least we will have better clarified for the American people what the debate is about. So with that, I just want to say again how much I appreciate everybody for participating. And I am going to now turn it over to Senator McConnell so that he can make some opening remarks, and we'll just go back and forth between the Democratic leaders in the Senate and the Republican leaders, House and Senate, and then we'll just open it up and we'll start diving in. All right?
Thank you very much, Mr. President. John Boehner and I have selected Lamar Alexander of Tennessee to make our opening framing statement, and let me turn to him.
Thanks, Mitch, and John. Mr. President, thank you very much for the invitation.
Yes.
Appreciate being here. Several of us were a part of the summits that you had a year ago, and so I've been asked to try to express what Republicans believe about where we've gotten since then. As a former governor, I also want to try to represent governors' views. They have a big stake in it. I know you met with some governors just the last few days.
Yeah.
And we believe that our views represent the views of a great number of the American people who have tried to say in every way they know how, through town meetings, through surveys, through elections in Virginia, New Jersey, and Massachusetts, that they oppose the health care bill that passed the Senate on Christmas Eve. And more importantly, we want to talk about, we believe we have a better idea. And that's to take many of the examples that you just mentioned about health care costs. Make that our goal, reducing health care costs, and start over. And let's go step by step toward that goal. And we'd like to briefly mention, I'll briefly mention, and others will talk more about it as we go along, what those ideas are, what some of them are, what some of the suggestions we have are. I'd like to begin with a story. When I was elected governor, some of the media went up to the Democratic leaders of the legislature and said, what are you going to do with this new young Republican governor a few years ago? And they said, I'm going to help him, because if he succeeds, our state succeeds. And they did that for us, the way we worked for 8 years. And but often they had to persuade me to change my direction to get our state where it needed to go. I'd like to say the same thing to you. I mean, we want you to succeed, because if you succeed, our country succeeds. But we would like respectfully to change the direction you're going on health care costs, and that's what I want to mention here in the next few minutes. I was trying to think about if there were any kind of event that this could be compared with, and I was thinking of the Detroit Auto Show, that you had invited us out to watch you unveil the latest model that you and your engineers had created, and ask us to help sell it to the American people. And we go and you do that, and we look at it and we say, hey, that's the same model we saw last year. And we didn't like it, and neither did they, because we don't think it gets us where we need to go, and we can't afford it. So as they also say in Detroit, again, we think we have a better idea. Your stories are a lot like the stories I hear. When I went home for Christmas, after we had that 25 days of consecutive debate and voted on Christmas Eve on health care, a friend of mine from Tullahoma, Tennessee said, I hope you'll kill that health care bill. And then, before the words were out of his mouth, he said, but we've got to do something about health care costs. My wife has breast cancer. She got it 11 years ago. Our insurance is $2,000 a month. We couldn't afford it if our employer weren't helping us do that, so we've got to do something. And that's where we are. But we think to do that, we have to start by taking the current bill and putting it on the shelf and starting from a clean sheet of paper. Now, you've presented ideas. There's an 11-page memo on I think it's important for people to understand there's not a presidential bill. There are good suggestions and ideas on the web. We've made our ideas, but it's said it's a lot like the Senate bill. It has more taxes, more subsidies, more spending. So what that means is that when it's written, it'll be 2,700 pages more or less, which means it'll probably have a lot of surprises in it. It means it'll cut Medicare by about $500 billion and spend most of that on new programs, not on Medicare and making it stronger, even though it's going broke in 2015. It means there will be about $500 billion of new taxes in it. It means that for millions of Americans, premiums will go up because when people pay those new taxes, premiums will go up, and they will also go up because of the government mandates. It means that from a governor's point of view, they're going to be what our Democratic governor calls the mother of all unfunded mandates. Nothing used to make me madder as a governor than when Washington politicians would get together and pass a big bill, take credit for it, and then send me the bill to pay. And that's exactly what this does with the expansion of Medicare. And in addition, it dumps 15 to 18 million low-income Americans into a Medicaid program that none of us would want to be a part of because 50% of doctors won't see new patients. So it's like giving someone a ticket to a bus line where the buses only run half the time. When fully implemented, the bill would spend about $2.5 trillion a year, and it still has the sweetheart deals in it. One's out, some are still in. I mean, what's fair about taxpayers in Louisiana paying less than taxpayers in Tennessee? And what's fair about protecting seniors in Florida and not protecting seniors in California and Illinois and Wyoming? So our view, with all respect, is that this is a car that can't be recalled and fixed and that we ought to start over. But we'd like to start over. When I go down on the floor, and I've been there a lot on this issue, some of my Democratic friends will say, well, Lamar, where's the Republican comprehensive bill? And I say back, well, if you're waiting for Mitch McConnell to roll in a wheelbarrow in here with a 2,700-page Republican comprehensive bill, it's not going to happen because we've come to the conclusion that we don't do comprehensive well. We've watched the comprehensive economy-wide cap and trade. We've watched the comprehensive immigration bill. We had the best senators we've got working on that in a bipartisan way. We've watched the comprehensive health care bill, and they fall of their own weight. Our country's too big, too complicated, too decentralized for Washington, a few of us here, just to write a few rules about remaking 17% of the economy all at once. That sort of thinking works in a classroom, but it doesn't work very well in our big, complicated country. And it doesn't work for most of us. I mean, if you look around the table, and I'm sure it's true on the Democratic side as it is on the Republican, we've got, shoe store owners and small business people and a former county judge, and we've got 3 doctors. We've got people who are used to solving problems step by step. And that's why we said 173 times on the Senate floor in the last 6 months of last year, we mentioned our step-by-step plan for reducing health care costs. And I'd like to just mention those in a sentence or two. You mentioned Mike Enzie's work on the small business health care plan. That's a good start. It came up in the Senate. He will explain why it covers more people, costs less, and helps small businesses offer insurance. 2, helping Americans buy insurance across state lines. You've mentioned that yourself. Most of the governors I've talked to think that'd be a good way to increase competition. Number 3, put an end to junk lawsuits against doctors. In our state, in half the counties, pregnant women have to drive to the big city to have prenatal health care or to have their baby because the medical malpractice suits have driven up the insurance policies so high that doctors leave the rural counties. Give states incentives to lower costs, number 4. Number 5, expanding health savings accounts. Number 6, House Republicans have some ideas about how my friend in Tullahoma can continue to afford insurance for his wife who has had breast cancer. Because she has a pre-existing condition, it makes it more difficult to buy insurance. So there's 6 ideas. They're just 6 steps, maybe the first 6, but combined with 6 others and 6 more and 6 others, they get us in the right direction. Now, some say we need to rein in the insurance companies. Maybe we do. But I think it's important to note that if we took all the profits of the insurance companies, the health insurance companies, entirely away, every single penny of it, we could pay for 2 days of the health insurance of Americans, and that would leave 363 days with costs that are too high. So that's why we continue to insist that as much as we want to expand access and to do other things in health care, that we shouldn't expand a system that's this expensive, that the best way to reduce cost, to increase access, is to reduce cost. Now, in conclusion, I have a suggestion and a request for how to make this a bipartisan and truly productive session. And I hope that those who are here will agree. I've got a pretty good record of working across party lines and of supporting the president when I believe he's right, even though other members of my party might not, on